It was another record-breaking day in Canada's biggest COVID-19 hotspots, with new daily highs of COVID-19 cases. Alberta is reporting 1,879 new cases in the last 24 hours, the most recorded in that province in a single day. Ontario recorded 1,859 cases, and Quebec has become the first province to record over 2,000 new cases. Nowhere is the situation more dire than in Canada's long-term care homes. When the vaccine finally rolls out, there are calls for the first doses to protect the most vulnerable. Abigail Bimman has our top story tonight.
Barbara Beggs died in an Ontario long-term care home in October. Her daughter, Joanne, not allowed to see her during the first wave of the pandemic.
Her being isolated, me not being allowed in, I would have been all over that so much earlier. You know, maybe she could have kept the use of her hands. Maybe she didn't have to suffer like that so long.
Beggs now worries about her father in long-term care. She wants to make sure essential family visitors like her have access to the vaccine in the first round.
Our loved ones cannot afford being barred from us once again.
The thing we've not heard yet in the news that we're waiting for is clear messaging around the prioritization of our long-term care seniors, our residents, our staff, and our essential visitors.
Provinces are responsible for decisions like that, but a military planning directive obtained by Global News shows Track 1 vaccines, those first 6 million doses, will be handled by a federally coordinated strategy because provinces don't have the infrastructure nor experience. And the Federal Vaccine Advisory Committee recommends long-term care residents and staff be vaccinated first.
We hear information about when this vaccine is going to be ready to be basically put into people's arms, and yet we still don't have the list of priority people who are going to get it or how they're going to get it.
Those are actually the types of issues that we are actively discussing with our counterparts in the provinces and territories.
It's a complex process, especially for the Pfizer vaccine, expected to be approved first. It needs to be stored in ultra-cold freezers and not move too much.
So I think the key question now is what models are ideal for vaccinating people that might not be mobile.
We're going to need to start having these conversations with thousands of substitute decision makers. So you can't just, be told within a day that the vaccine is coming. This sector needs to be involved, and right now they're kept in the dark.
People who are actually giving the shots on the front line should also be calling the shots.
Palliative care physician Dr. Amit Arya specializes in long-term care. He says those in the sector need a seat at the table in the planning.
I think it would reassure people to have a clear plan in place to know these are the benchmarks, this is the plan, with an understanding that some flexibility.
The Ontario government tells Global News it will have more to say on all pieces of its vaccine rollout plan soon. Abigail Bimman, Global News, Ottawa.